This is ZengoMD. How about putting a few thousand holes in your face every 2 to 4 weeks and somehow it makes your skin look younger and better? Yeah, that sounds pretty crazy to me, but let's take a few minutes to look at one of the most promising new, minimally invasive cosmetic medicine procedures of the last decade and answer some myths and misconceptions about this popular treatment. Please keep in mind our disclaimer that this is educational in nature and not an endorsement to do this procedure anywhere but with a licensed professional using FDA cleared equipment. You'll see why shortly. Of course, if it's good for a world class golf course, it has to be good for our face, right? This is aeration, a common procedure that is done to lawns to allow air to get to the roots and allow the roots some room to expand. While skin is a little more complicated than a golf fairway, there are some similarities. Using sterile needle devices like rollers, stamps, and motorized pens, one can put rows of little channels into the skin surface at a variety of depths to achieve a result. These devices are mostly marketed to consumers with no way to prove quality or sterility. Professionals tend to use only the motorized pen since you can use a fresh needle head on each patient, but more on the legal issues and choices with devices like this later. This is the best book on microneedling written for professionals, but you can grab it on Amazon even if you're not a medical provider and learn everything there is to know about microneedling. Microneedling at different depths, different time intervals between treatments, and different topical agents used after the treatment can promise many of these improvements in your skin, including the reduction of fine lines, wrinkles, and it provides a great exfoliation and can reduce pigment if done enough times, help with overall glow to the skin, improve texture and uniformity, improve circulation, even trigger fibroblasts to create more thickness, and even help with elasticity of the skin. Special deeper protocols can treat all kinds of scarring, be it acne or due to surgical scarring. Finally, needling can also be done through wet products and even through your own platelet-rich plasma to enhance absorption into the key layers of the skin. Now that we have set the stage, let's talk about the 5 things you need to know about microneedling in detail. The first thing you need to know is that the face must be clean, really clean. This may seem obvious, but we really clean the skin well before we place an IV, right? And that's just a single needle stick. So you should disinfect your face well if you're going to stick it a few thousand times. So after washing your face with soap and water is the essential first step, it needs to be followed with a prep with at least alcohol at the least, or more likely some of this stuff, which is approved for surgical prep. It is called chlorhexidine. The brand in the blue bottles has a pink coloring in it, and we'll learn shortly that we don't want to use any colorings. Others are blue tinted, so it is best to use the generic chlorhexidine, which is clear. The next thing you need to know is depth. The legal limit for estheticians is the epidermal layer only, or depths around zero point 0.3 millimeters or less, which is also the depth the most commonly sold home rollers have. This can help with getting nutrients to the epidermis and to the pigment producing melanocytes while creating a great exfoliation at the same time. However, in order to address these important areas which go deeper than the visible epidermis, most people need some prescription strength anesthetic cream first, followed by a sterile prep, followed by what is called medical microneedling, which is zero point 0.5 millimeters deep to around 1 to 1.5 millimeters deep. And someone with more advanced licensure than an esthetician must do that job. And over time, you will see these benefits too. What you don't need is a really deep, painful treatment that goes deeper than 1.5 millimeters because that has never been shown to get better results except maybe for scars, which distort your skin and can go deeper than 1 millimeter. So remember, if you go to an esthetician for needling and they go deeper than the epidermis or draw blood from the skin, which is evidence that the dermis was breached, then they are practicing outside of their licensure. Next, a frequency of treatments is really important. Doing it too soon is not going to get you any better any faster. Doing it once and expecting to look years younger is also unrealistic. It's pretty simple when you're just looking for improved glow, skin tone, and texture, or are working mostly on pigment. You can be needled to around zero point 0.3 millimeters twice a month. Anything deeper, which is called medical needling, should be done once monthly. Next, did you know that half of the potential benefit of microneedling is caused by the skin care products you use on the needled area for the next 5 days, not just the act of needling alone? I mean, would you aerate a golf course and forget to provide the sun, the water, and the fertilizer for the next few days? And we spend lots of money on skincare creams and serums, but they all contain ingredients to assist with absorption through intact skin. After all, skin is built to be a barrier, protecting us from our environment. So it takes ingredients like acids and exfoliants and chemicals to help a product absorb. Even then, only around 7% of what is applied is absorbed. Think about that the next time you buy some $100 serum with growth factors to use on intact skin. But the needled skin has wide open channels that allow for around 80% absorption about 4 days after the actual needling. One problem is that the skincare aisle doesn't feature products that are made for needled skin. Their products are designed for intact skin in addition to be looking and smelling pretty. But most have ingredients that, when injected into the skin or absorbed through needling channels, can be inflammatory to the skin and cause harm. The last thing you want to do if you have an open wound is cause more inflammation. That'll cause pigment and potential scarring. According to Setterfield, the ideal skincare regimen that should be used post needling is a hyaluronic acid, especially high molecular weight ones, pure vitamin serums, plus possibly some copper peptides. The regimen for the first 4 days post needling should not include products with any of these ingredients: colorings, which can stain the skin, perfumes, which can inflame and irritate the skin, preservatives, emulsifiers that can affect the fat in the skin, humectants, which can dry out the skin, acids, which are added to soften the dead skin layer and unnecessary on needled skin, and, of course, parabens. Good luck finding anything like this on the shelf at your local store. It reminds me of when I was in medical student on general surgery rotation and I was taught the rule: don't put anything into a wound that you would not put into your eye. And microneedling is basically making thousands of very tiny microscopic wounds to the face to allow that healthy healing process to make you look better in the long run. So once you get done reading the ingredient labels for your post-needling regimen, consider these important points about safety. Well, let's start with a question. Name one device that is sold directly to consumers, unregulated by the FDA, that is designed to break the skin's surface. Maybe an insulin syringe, that's about it. But those are used one time and discarded, and they're not used on your face. Most patients are encouraged to clean their needling rollers after those needles puncture the skin thousands of times. And trying to clean that at home and getting those needles back to sterile is very difficult, if not impossible. Quick look at a bunch of YouTube videos shows an assortment of examples trying to use alcohol or denture tablets to clean needling rollers. Keep in mind that no surgical instruments that are reused on patients are sterilized with alcohol or denture tablets. Nothing. Not done because it doesn't work. Trust me, you don't want your next surgery to use instruments cleaned with alcohol or denture tablets from the prior surgery itself. Alcohol does nothing to kill bacterial and fungal spores or mold. You could avoid this issue by using a fresh roller or stamp every time. But how then do you know that it was sterile to begin with? It's kind of like the honor system, because these things aren't FDA cleared. And that brings us to the FDA. Anything that is sold to break the skin and reused is regulated by the FDA. Eventually, in 2018, the FDA did make a ruling that microneedling instruments would need to be FDA cleared as Class 2 devices. That means that every single device sold, whether it has a motor or not, needs to pass FDA clearance. The first device to do this was a motorized pen called the Skin Pen in 2018. The latest is the all-digital DP4, and there are four others in between that are also FDA cleared. In order to get cleared, these pens needed to develop their own sterile lubricant, in addition to proving that no body fluids could transfer from the needle head into the pen housing. This takes a lot of work, something that every other roller or stamp or pen has not done. So just because a motorized pen might be sold on Amazon, it doesn't mean it's FDA cleared, and you can't be sure the needles are even sterile. You're taking a tremendous risk as a patient or a provider. Finally, here is how you can look up if your device is properly FDA cleared. First, you go to this website. Then type in the name of the device here and the letters QAI, that's QAI in the device code. This will bring you to a page where the device will be listed if it has been registered with the FDA. Finally, you must click on the device and confirm that the listing class for the device is Class 2 and not Class 1. This means that the FDA has tested the device in compliance with their 2018 guidelines. This is an example of the listing for the FDA-cleared skin pen. But look what happens when you search skin pen, searching skin pen as two words. You get a Chinese manufacturer, and then you click on a name and see a number of different names, aliases, so to speak, for this equipment, names like DR pen and DR roller. However, they are only listed as Class 1. So none of these have been rigorously tested, nor are they FDA cleared for microneedling. The number here must be a 2, not a 1, which simply requires paperwork to be filed. Look, these devices are not toothbrushes. They're invasive and can do harm, as can the wrong home care regimen after needling. Until we have FDA cleared home rollers and stamps, I would strongly suggest that you do not try to do this at home, and only select a provider who uses the FDA cleared equipment that you know is sterile, and you know that body fluids will not leak through the needle head into the motorized pen housing. And also choose a provider who is actually trained to break the surface of the skin. You have only one face. Don't trust it to anything less than the right equipment in the right hands. Thanks for watching. Goodbye.